Umlazi and black schools, we had a period where we knew it was a free period. That was about guidance, which is called guidance period. So it's supposed to be a guidance teacher is going to say, your personality is like this, maybe do that, because you could have the same marks, but your personalities are not the same.
Of course.
Just like nurses in medicine, if you're an operating doctor, so you're either cardiothoracic surgeon, cardiologist, pulmonologist, you cannot do your work without a technologist. It's virtually impossible.
So I'm a big believer in getting some exposure to different sort of fields.
Yeah.
Like now when I talk to youngsters, my nieces and nephews, I'll tell them, just learn a little bit about something that maybe you have a general interest in, and that can help you maybe making a decision. Like how you say, when we come out of school, we are so green. We don't know what these different fields are about.
Yeah.
So you're getting paid at the time.
I was paid maybe, what was 200 rand a month?
That was.
I used to go to the bank and then withdraw 50 rand at a time. One note. Sometimes I used to forget and it used to be insufficient funds.
Honestly, Brian, that's a sore topic because transport was so
it was
high.
more than what we got.
Welcome to Rhythm Unplugged. I've got two fine young gentlemen here. As usual, I can't forget that we're being hosted by Mawando, my creative replay. Here today we are now having a session with two young gentlemen, Justin Ragadu and Klindheer Rampesad with no H.
Of course,
One of the reasons why I like engaging the public on these things is to create a platform, or the podium rather, where we discuss medical issues. Part of medical issues are clinical awareness, but who provides that? We've got doctors, we've got nurses, we've got auxiliary people that help us, right? But there's one thing that I never knew until I was well into my postgraduate. There's something called clinical technologist. It's something that was new to me. And over the years, I've realized the invaluable things that you guys offer. So today we're going to talk about your careers. What is it that you do? How do you help doctors? How do you help manage patients? And so who do we start with? Let's start with Klindheer. Yeah. Who are you? How did you get to this? Basically, both of you guys can...
Well, my story started with electrical engineering. I did it for a year and I was not happy. So
you did do it?
I did do it. I was accepted. After matric, electronics, they called it then, right? Electrical engineering, light current. I wasn't happy. So I told my mom, you know what? I'm not happy. I want to change my direction. So then I spoke to my sister, and she was a clinical technologist then. So she said, okay, right, you can speak to one of my colleagues. I'm sure you probably know him, Vishal Maharaj. So I spoke to him and he advised me on cardiology, and he said, no, this is what clinical technologists do, and you do it, and I'll employ you.
Your sister is older than you, right?
She's older than me by about 4 years, I think.
How did she get to it herself? Do you know?
I'm not actually sure. It's probably one of... somebody advised her on it, like I was advised. But
so she's
that's
the
how
one
I got
who advised you to get into it.
Advised me, and then I spoke to somebody from the faculty I wanted to go to, the cardiology, basically, and
before I forget and before we get to Justin,
I
think I have a daughter who's turning 23 this year, and she finished law, and now she's thinking about doing medicine. So one of the big things that I'm a proponent for is a gap year, because most of these kids, when they get to mature, they could be 16, 17 or 18. They're quite young. You have this utopian thinking, I want to be this, and that. When you get there, you realize, I don't like what I do. So I always prefer that, grow a little bit older, experience the world, and then make a decision. Because not only that, sometimes you may get lost and finish electronics or light current engineering, and then you hate it for the next 40, 45 years. Right? So you didn't waste, education doesn't get wasted. But time could be. You did 1 year already before
Yeah.
you figure out there was something else that you could be happier at.
yeah.
So that was your journey at the beginning, right? What about you, Justin?
So me, I always
As I call
had
him, Just I.
yeah, just time, AKA. But yeah, so for me, my initial feeling was I want to do something in the medical field, right? So I'll finish.
Why medical field? If I might interject.
I think when I was growing up, you get good marks in school. Your family says, okay, you're getting A's. Why don't you be a doctor? Why don't you be a lawyer? So I sort of had this lot of gravitational towards doing something in the medical field. And I enjoyed bio. You know, that's our experience with what we know about medicine.
Well,
We
don't say
start learning
bio
about-
because younger people will say, what is bio?
Yeah.
What do they
Biology,
call it
we used to call it
I don't know, social sciences, I think, I don't know. Yeah, natural science.
something
Yeah,
like
I
that.
don't know,
I just know
yeah.
it's changed, the
Yeah.
terminology.
life science.
Yeah.
Oh,
I
life
think it's
science,
life
that's
science,
it,
yes.
yeah.
So because you learn a bit more about the human body, and I started getting fascinated with that, and I thought, okay, this doctor thing sounds good. Then I hit higher grade maths, and then I was like, hey, maybe it's a bit hard to be a doctor. But I always knew that I wanted to do something in that field. So that's my general sort of thing. So for me, then I looked at my choices, and then there was something about biomedical technology, there was physiotherapy, there was psychology. So eventually I said, okay, maybe I'll try this biomedical technology, right? Because it's something to do with analyzing maybe samples or whatever in a lab. And I was a bit more introverted at that stage. So that was my initial thing. So I checked up in the DUT, they had this field called medical technology. You could get into it, and I signed up and everything. Eventually, my mom is a nurse at that time it was at SAN, and she met a guy who was a Klindheer. So she checked him out. She said, "Oh, this guy's a very nice guy. He goes into theater. I don't know exactly what he does. He's driving a nice car. It's a convertible.
Yeah.
Come on, you need to check out what this field is about because it's looking like it's something good.
Whatever he's doing,
Whatever
it
he
looks
does, he
good.
goes into theater, he comes out and he drives a nice car. That was it. So I said, okay, fine, I'll check it out. And then I met the guy. He came
That
with
was
me.
before you start your bioengineering.
Yes.
Okay.
This was like, I'm ready, I was enrolled.
Yeah.
So I go with him into the tech, and then he's like, he speaks to the prof there, and he's like, okay, no, this guy, look at his marks, and he's done well. So can you change him? I think you'd prefer to do Klintech. It's a bit more, what's like better. So I said, okay, I'll try it. So that's how basically I got into this field.
Who is this
of
guy you're talking
clinical.
about?
He's a tech now. He works here in a couple of places. Amit.
Oh, yeah. Oh, Amit.
Yeah.
Oh, okay, yeah. Shout out to Amit.
Yeah. So he
So for
basically-
you were enrolled by, not enrolled by, I mean, someone advised you was Vishal.
Yeah.
It's like a legendary clinical technologist
Yeah.
in KZ and Durban. All right. And you, it was Amit.
Yeah.
Yeah.
So I'm a big believer in getting some exposure to different sort of fields.
Yeah.
Like now when I talk to youngsters, and my nieces and nephews, I'll tell them, just learn a little bit about something that maybe have a general interest in, and that can help you maybe making a decision. Like how you say, when we come out of school, we are so green. We don't know what these different fields are about.
Yeah.
And there's so much of diversity now, especially in this day and age where we're getting this AIs, and they say a lot of jobs that people are going to get into are not invented.
Yeah.
So, it's just nice to get a little bit of exposure.
Yeah.
So,
On everything,
yeah. So I guess, so for me now, I got into this Klintech, and like Clint says, initially, like when you get into the class, there was probably less than 10 boys, and maybe about 20 to 30 females.
Oh, yeah. So because it's like 30% or less.
Yeah.
It was largely female dominated.
I was a bit like hesitant. I'm like, is this like a sort of, dominated by girls? What sort of field am I getting into? Like,
What was the concern about more
Just
females?
I don't know, like I didn't know exactly what Klintech was about.
Right,
I just
okay.
know that this guy told me it's good field and it's medical. It's a lot of technology. A lot of you meet patients. It's like we go into theater. We do this.
Very
that.
clinical.
Yeah. So I thought, okay, I think I'd like it. But when I got to the class, I was shocked that there were so few males.
Yeah.
But anyway, I think the general consensus, even amongst the guys when we start, we don't really know what this field is.
Yeah.
And when we start, we do these sort of courses based on general anatomy. Then you start going into like different biomedical apparatus. How are you using different technologies? It's a very broad-based sort of thing that we all sort of learn initially. And then you start focusing after that. So 2 years?
after the 2 years, it becomes more important.
Yeah.
You sort
Because
of
you go
choose.
into the hospital and
Yes.
you figure out what you want to do. Like there's 7 different
Yeah,
faculties.
so you can
right?
get into the brain,
And,
you can get into kidney.
Okay, before we get to
Yeah.
that,
Yeah.
so
Yeah.
Clint and I share. I didn't waste. It was kind of like forced for me to have a gap
Uh-huh.
because of socio-economic circumstances.
Yeah, yeah.
But you also spent almost like 12 months.
12 months, yeah,
Justin
yeah, yeah.
probably was much better off. Hopefully, he'll tell us later if he doesn't regret being a clinical technologist. But I think the most important thing for me and for you to be here today is reach out to young people who are unsure what they want to do.
Yeah, for sure, yeah.
Because once again, like Justin said, you look at your marks, you probably did the same thing. Say, okay, I can do this. I can tell you right now, in Umlazi and black schools, we had a period where we knew it was a free period. That was about guidance, which is called guidance period. I don't know what they call it now. So it's supposed to be a guidance teacher is going to say, your personality is like this, maybe do that. Because you could have the same marks, but your personalities are not the same.
Of course,
Even
yeah.
doctors, we've covered this before in our certain podcast. They say it could be a doctor who doesn't really interact well with the patient. Maybe you've got, you like empathy. Maybe be a radiologist. You know, if you're an extrovert, you like seeing patients over and over again. Internal medicine, right, kind of thing. So I just didn't know when I was in matric that there was something else other than being a preacher, a nurse, doctor, lawyer. I didn't even know it was accounting. Yeah, so the kind of few things that I knew that I could get into. I was telling you earlier on that I was thinking of being a marine biology. I can't even swim. I don't know if
You
it's
told us you
I don't
don't
know
like
if
the
it's a
water,
skill.
yeah.
I don't know if it's a skill
Yeah.
that is required as a marine biology, but I like to think that you need to be able to swim.
You gotta like the water, yeah.
But it was just this nice wording to it. So, but to get into a career and to like it and sustainable and be able to provide for yourself and your family is something different. And it's something extremely important for the young ones to know that they've got choices out there. But also, I mean, in your case, you spoke to your sister. In your case, you spoke to your mom. So the family is important.
Yeah.
But it could work in a different direction because I remember this guy that I was with in medical school. He wanted to fail medicine because he hated it, but his parents wanted him to be a doctor. So sometimes
A shame.
you do get parents
Yeah.
who want to guide you to live their lives through you. But it's also important to know that you've got parents, like in your cases, where they can guide you. So getting into that is very important to me.
Yeah.
Now you get into DUT, both of you are DUT, right?
Yeah.
To the University of Technology.
Yeah.
How was life in the campus? You can talk at the same time.
I think it was awesome because for us it was very lively. Used to go for our lectures, sometimes not.
Yeah.
Sometimes.
being young
Yeah,
boys.
we've been young boys,
And young
you know.
girls.
Yeah, we had in the campus they had a cafeteria.
Did you enjoy it?
Yeah, it was amazing for me. I loved it. Yeah, because
Justin,
I think
like,
for
it
me,
didn't take.
my campus life, I don't think was all that grand. Like I mean, we meet with one of the reps we worked with. I was in my class. And I think I was at that stage where I was a bit more introverted, and I didn't have that many friends. I used to go to my lectures, whatever, and then I was probably looking to get back home. I wasn't much on the social scene,
Oh.
but I mean, it was.
Would you say the 3-4 years you spent there, was it more enjoyable class and social not so good?
actually we spent 2 years basically
Yeah.
on campus,
There's just
and then
2 years.
after that we went to the hospital. Yeah, so the other 2 years were at the hospital.
That's I think is
yeah.
a beneficial thing about being in that technicon we were called it
Yeah,
in those
yeah.
days. Is that those first 2 years are initially a sort of a broad-based educational direction, and then you choose where you want to go and they place you. Like for me, I got placed in Albert Tully to do a year of sort of in-service training. So you're still getting your qualification. That time
Are you getting paid at the time?
I got paid maybe what it was 200 rand a month.
Yeah, that was.
I used to go to
that's
the
a
bank and
very-
then withdraw 50 rand at a time. One note.
Yeah.
Sometimes I used to forget and it used to be insufficient funds. And
Honestly, Brian, that's a sore topic because transport was so
Yeah, it was
high.
more than what we got.
Yeah, so.
But I mean, that was.
But you're like 19, 20, so it's not so bad. I mean,
but we still had to get to work, right?
Yeah, and girls were there.
So
you know,
I had a lift club.
Yeah.
Yeah, so I had a few people that used to travel from Phoenix to Albert Lutuli and Wentworth. I took them. That's how I got petrol money, you know.
Do you
Yeah.
think they still get, well, let's call it a stipend. Do you think they still get a stipend?
I'm actually not sure.
not sure.
It would
not
be
sure.
great because, you know, sometimes you get people who really from destitute background. Like during our time, I think if you're extremely poor and you got great marks, whether you become a doctor or nurse, some people chose become a nurse because soon on the first month, you get a stipend.
Yes.
Right.
Yeah,
While
yeah.
as a doctor, you get a stipend 5 years well, on your 6th year. So it could be, as in chemistry, rate determining step in terms of what you're going to be.
Yeah.
So I think
Yeah.
it's nice for people to know that you may get something out of it on your, was it 3rd year?
Yeah.
Or first year?
3rd year.
3rd year when they place you.
Yeah.
It may sound inconsequential but for other people out there, you know, it could be something.
Yeah.
All right.
Quick pause, guys. Today, the whole podcast is totally sponsored by Creative Replay. You know who they are, Mawanda, Mapumola, Mashimane. So we've been together, probably going to be closing on a year. When I first started on this journey, I thought I could make it. And all my colleagues are asking me, who's doing that work for you? For 2 reasons. One is the quality that they bring into the podcast, and 2, professionalism. So I don't have time to be doing this all by myself. I do joke about it and say I'm doing it, but Creative Replay has been behind this wonderful, relatively short journey, but very, very meaningful. So they take away all the stress of doing something like this because I'm really passionate about impacting knowledge and my experiences, and Creative Replay makes it easy for me to manage my time and to engage with you as a family. Thank you very much once again, Creative Replay, for doing all what you've done for me. Big ups.
So 2 years and then you get placed. And then how do they choose to place you? Is it where you're coming from? Because I know there are not that many university of technology in the country. How many are there roughly in SA?
From what, yeah.
Yeah, I think there's 4.
Cape Town,
There's one in Cape
Pretoria.
Town, Pretoria, Joburg, and
So it's high demand.
This
it
as
must
far
be
as we know,
difficult.
right?
Yeah.
Yeah.
Must be
It's
difficult
fun.
to get in though.
Yeah,
There is probably a waiting list. There are
Yeah.
lots of...
There
There's lots of
probably will
people.
be.
There's a waiting list. Yeah.
So when did you start enjoying yourself? So you're a bit of an introvert first 12.
Yeah, well, I
24
think
months.
once I got more into working environment, started seeing that the clinical aspect of it, seeing patients,
Being at the hospital.
Yeah,
Yeah.
and I think I
Yeah.
started
So
enjoying.
placement meaning being at the hospital setting.
Yeah,
Yeah.
and then you're actually putting your knowledge into action. You're learning on the job, and that environment. I think I started enjoying more about what Klindheer offers as a job and just as your life now.
Yeah.
Okay.
So yeah.
So by the time they place you, have you decided what subspecialty you have to take? Can you just break it down? How do you move from your first day at the technicon or university technicon to be a cardiac tech or respiratory tech? When do you make that decision?
In your 3rd year. So yeah, you get placed in your 3rd year.
So the first 2 years are the same.
Yeah, it's the
Everyone.
theory. It's the theory. Yeah. So
Okay.
you do all of that, and you pass your subjects, and then you choose what you want to do. So I chose cardiology, and so we both did, and and we got placed. I got placed at Wentworth,
So you could have been otherwise maybe neurotech,
neuro or renal,
whatever.
pulmonology, yeah.
Yeah. I think for people out there who probably have had something about tech, for me would have been when people do a bypass surgery. So we kind of like know more of them, at least for me in cardiology.
Yeah.
What do you call them?
Perfusionist.
Perfusionist.
Yeah.
That was a buzzword, perfusionist.
Yeah.
I think right there, the most important thing when it comes to this profession, and I think it has to be loud and clear, just like nurses in medicine, if you're an operating doctor, so you're either cardiothoracic surgeon, cardiologist, pulmonologist, you cannot do your work without a technologist. It's virtually impossible. So just to put light into what these guys are doing, if either of them are not available, I take leave That's how important it is. It's an integral part of what you do. So you get placed, and then for how long? A year, 2 years?
So when we were there, it was a year, and now it's 2 years, right? So,
So
now it's
So-
mandatory,
yes,
I think, to
you
get
have
a
to do
degree.
4 years, now.
So
But,
2 years in Technicon, University of Technicon,
Yeah,
and then 2 years of placement.
yeah,
Yeah.
now, that's currently what it is, and then you come out having a degree.
Degree, a
Yeah,
BTech
a
degree.
BTech
yeah.
degree. Do you have to do community service, or do you have to do?
No, I think the 2 years is basically your service that you, and then after that you can decide what you want to do. And if you get a job where you.
Oh, let's
you
talk
place-
about that.
Yeah.
Because there, I understand, subject to correction, there's more than 1,300 doctors who don't have placement, either at the level of internship or
Yeah,
community
I've
service.
heard. Yeah.
Yeah. So when you get, are you almost certain of getting placed in 2026 when you finish your first 2 years?
No, no, that's the unfortunate thing, because I think they saying that it's saturated at the moment, the field. People are
And I
making their
guess-
own inroads. They start in private
I
practices.
guess also for you,
yeah.
the difficulty is that you probably have to work in a bit big towns or cities, because you're not going to go and work in Mlazi. Okay, I come from Mlazi, so I'm not dissing Mlazi. You need to work where there is a specialist.
Yeah.
So, and most specialists are concentrated in big cities.
That's true.
So there's
yes.
a kind of a bottleneck there.
Yeah. So that's what's happening, and then you find in more people going overseas. They finding jobs. People.
We'll
are
come back to
taking
that point
yeah.
because what I like about what you guys are doing is, okay, let's hold that thought for now, going overseas and other stuff. So once you're done, you go to 2 years and you get a degree. And then how do you go about then what's there for you?
So I'll tell you what happened for me. Sorry. The DP Naidu was our
Professor
prof
DP
there.
Naidu,
Yeah.
yes.
So
Was
he
HOD at
actually
Albert Lutuli.
he actually found places for us to work, and the 3 girls that were with me, they had places to go to, and I was going to be sent to somewhere rural because I didn't want to go, so I decided to go into practice with another technologist.
You just
at Westville.
contradicted me. So we're
Yeah.
going to go rural. Is there, so rural, but hospital probably that was doing some sort of
Yeah, but not
cardiac operations.
when I say rural, maybe for me,
Like a-
stand away from home. Yeah.
Oh,
so
okay.
yeah, so I decided not to
Because it's
take
important
that.
for someone
yeah.
listening out there that these are the challenges that you may have to face, where you're going to be placed at.
Yeah.
You know, because like I said, once again, you don't work with general practitioners, do you?
No,
It had to be some sort of intervention.
it has to be.
I think from our point, if we do a test for a doctor, he needs to be qualified to read that result.
like a physician, basically.
Yeah,
Yeah,
so
not a
somebody
GP. Yeah.
Yeah, somebody.
Overseas, they will call you physiologist, right?
Yeah.
Yes,
You
of
are
course.
physiologist.
Yeah,
international.
Yeah, so-
There's rad techs, there's different terms for different techs I see.
Outside cardiology, can you just tell us the most known kind of technologies for people out there? Like I said, the first time I heard of a technologist was a perfusionist. What do perfusionists do? I know you're not a perfusionist, but you'll know.
Well, from my understanding is that they keep the
Just brief, yeah.
Yeah, they assist the surgeon with the bypass
The
machine,
bypass
keeping
procedure.
the patient stable while the operation is going on with regards to the blood flow and
Yeah.
that sort of thing.
Yeah. And also in respiratory medicine, pulmonology, they will do lung function
Lung
tests.
function tests,
They'll
yeah.
be able to assess if the patient is getting worse.
Yeah.
The doctor can then act on those results. So you are a very integral part of specialized medicine.
Yeah, we basically assist the doctors to make informed decisions.
Yeah.
Yeah, so,
I think with
we do the
diagnosis,
diagnostic tests.
treatment, we assist with basically the technology aspect, because medicine is so technology driven nowadays, right?
Yeah.
There needs to be the doctor who is doing the procedure, and there needs to be an allied who assists him with all these different sort of equipment to get the best results for the patient, to make sure you troubleshoot if there's any issues,
Yeah.
to make sure it's all working fine, and diagnosing and treating the problems.
Yeah, so
just on that point, I mean, in my practice, for instance, I mean, if you get in our previous podcast, we spoke about implantable loop recorders where someone might come in with palpitations, awareness of the heartbeat, but nothing has been found. And sometimes over the last 15 years, you realize that sometimes you see patients that don't need to be seen by you because whoever referred to you maybe doesn't really understand what's happening with the patient or really doesn't understand what I do. And I've used you as an interface between the patient and me to say, do I have to see the patient? And the patient will. So let's say they come palpitation, you will decide to put a halter on, which is a 24, 48, 5-day halter to see if there's a problem. And sometimes people are referred to me as having heart failure. You can just do an echo within 5 minutes to know whether is there heart failure, there are different forms of heart failure, but you guys are equipped with that. So you, in my opinion, you are almost independent practitioners. Would you call yourself that?
Yeah.
Where you not just assist, you're part of the team. Because I don't like the term working for the doctor. You're working with the doctor, working with the practice. Will that be accurate?
Yes, I think so.
I think so, yeah. I think as much as, but we still fall under that allied's umbrella where we assisting the doctor.
Indispensable.
Yes, but I mean, definitely all of us have our components within the team, but you know, we do the test and then we obviously will give it to
It's
the
more.
doctor
It's more. We
to-
provide like support to
Yeah.
the doctor. Yeah, it's. I think
Well,
I think
yeah,
our role.
I think I mean I don't know if I'm putting you on a pedestal, but like for me, I definitely can't work without you. So I wouldn't say you're assisting. I'll say you work with me.
Yeah.
Yeah.
Yeah, and we
You won't
always
work
said
without
that,
me. I won't work without you.
Yeah.
As much as I won't work without a nurse. So people know who doctors are. People know who nurses are, but they don't know who's a technologist.
Yeah.
Yeah,
And sometimes in private practice, when you bill, I say, who is this Justin Rugadu? You know, I have to now explain. But over the years, we kind of like mastered that patients do understand that it's a team.
Yeah.
This is a team. I don't think you should see yourself as working for a doctor. You
Working
are
with the
team because you're indispensable. Show me one doctor who operates, who can do without a clinical technologist. That's for me, that's a facet of this profession where it's extremely important for the young people at home to understand that if you have a feel for mental, medical, whatever it is in the physiology of a human being, and you think you can deal with patients, this is, in my opinion, you let me know if that's true. It's a great opportunity.
Yeah.
Because yes, you are with the team, but you're also semi-autonomous. You know, you can bill for yourself. You can see patients by yourself. You can open clinics because you've got qualifications. Yeah. Tell us now. So once you're done, you're blessed, you finish your degree. How do you get to either stay in public or private?
Well, you got to look for opportunity, right? So you stay in public. In my case, anyway, until I found another opportunity, and I left. I went to Etiquette Hospital, and that's where.
So there
I
is a
started,
possibility that you can decide to stay in public,
or you
private,
can leave to private.
which
Yeah,
is also important, right?
yeah. You
How
can-
does that affect your life as as a breadwinner for the family? Do you think I can tell you, electrophysiology gave me more than just a good salary, but it gave me an opportunity to enjoy my life,
yeah.
have more time to myself, to my daughter, to my family, to my parents, to people I love. Clinical technology, does it give you that? Do you have that leverage?
Yeah, so my personal journey was initially I did a small stint in private because that was when I was just qualified. And I qualified when I was 21 years old.
A baby.
But I mean, I was blessed enough to get a job straight away. So I qualified like in December, by January I was working. And 21, right? So that's good in that sense. In Klindheer, you start earning quite early, you know?
Yeah.
Doctors have to
Wait.
before you start getting your first like real paycheck. So I started when I was 21. I got that job in private. Didn't work out for me, so I moved back into the public sector because a post opened up. And then there I spent a good 8 years. I did 2 years in cardiology, adult
Adult cardiology.
yeah. and then I did the rest, like another 5-6 years in peds, pediatric, because there was a higher
Invaluable
post.
experience as well.
Yeah.
Yeah.
So I always value that time that I spend in the state, in government, because I feel we get exposure to a lot of different pathologies.
Yeah, especially in government.
We
Yeah,
see, we see a lot. We learn a lot, and you don't always get that in the private sector. Right?
I think, sorry to interject, I just want to shout out to the government hospital, shout out to people who work for the state, because I, as a doctor, and you hear from the clinical technologists, we learn a lot in the state.
Yeah.
And we do go private practice, but state hospitals in South Africa, they provide us with great learning opportunity. And we're very grateful to that. And we often do not say that, but you hear Justin and Klindheer say how much they've learned from there. So big ups to that. Hopefully we could contribute back to the state hospital at some point. So that was your experience. And then you came private.
Yeah. So my when I got into the state, there comes a point where you sort of reach a ceiling, right? And
what was your ceiling? What
my
did
ceiling was I wasn't growing as much as I wanted to. And like you say, you're the breadwinner. My wife is also a tech, and you want to grow.
Your wife is also a
financially,
tech.
yeah.
Oh, these two
also a
people are
tech.
married to techs.
Yeah, and you want
Just
to grow.
saying.
Yeah.
And my family
If you want
was
to marry a
started-
tech, be a tech yourself.
Yeah, side note.
Hashtag.
So you meet nice people at work.
Yeah.
And then so my family was started, and I know there is a huge gulf when it comes to income with the government and when in the private sector. So you take a risk. There comes a time where you say, okay, you know what, I need to take this risk because I want to grow as in your income. So I went into the private sector.
So I told him to come.
Yeah, so he
So,
was
yeah.
part of pulling
So,
me.
yeah.
Oh, I know, because I was
yeah.
trying to recruit him for years and he didn't want to. I must say, of the two guys, the one I like most is Klindheer, because I've been in private practice for
Don't
15
say that
years.
now, yeah.
And Klindheer helped me from the beginning. And I really wanted him because he was coming with a different experience, right? A pediatric cardiology. As adult cardiologists, we've got very limited experience, particularly when it comes to echocardiography, anatomy for the kids. It's slightly different from the adults. So, but eventually, I've been blessed 15 years with you, and I'm
10.
up to 10. 10.
Yeah,
So it's been great. So you spoke a bit about your family and not getting exposure. What is it that you feel you get more in private practice compared to public? The foundation is that public provides us with a lot of experience. And we're grateful to that. But what is it that you get more, if that's the field that you have, like Justin, in private compared to public?
Well, the best, the money, right? It's, you get more
So
money.
monetary rewards.
That's
Time
time.
is flexible.
Actually, in the beginning, when I was working at eThekwini, it was 5 other cardiologists, right, at eThekwini. So time was limited because we had to work all the time. But when we joined your practice, we had a lot more time because we didn't have to do
flexi
call,
time.
right?
So flexibility.
Call
Call,
was
no
the
call,
was the
big benefits.
major thing for us.
Okay, let's walk you back. I want to walk back a little bit to youngsters. So you have an opportunity to be a clinical technologist. You have an opportunity to be a semi-autonomous, your own boss. Salary is much better. But one of the most important things, people kind of like forget about it until they are in their 40s and 50s, is the time you spend with the loved ones. So I think once you become your semi-boss, semi-autonomous, you're able to dictate your time. That's one thing in private. You also spoke about 5 cardiologists. So if you go to most public hospitals, you don't get more than 3-4 cardiologists in one hospital. And if you do, they probably have similar kind of experience. When you go private, you can work with a guy who does valve replacement, bypass, stents, electrophysiology, structural heart disease. Your experience increases a lot. Is that accurate?
It is, because they do more stuff in private than they do in government. And that
Sometimes-
is because they don't have as much money
Yeah,
as
the
they
resource,
do. Yeah, the resources
sometimes
are
dictates
yeah,
what
they
you can
do.
offer a patient, which is a fact. Yeah.
It is a fact. We can't run away from that.
Yeah.
We keep going back to these figures. 15% of South Africans can only afford private medical health care.
Sure.
Unfortunately, that's where in South Africa where you get this added experience
Yeah.
from the foundation of the public. So we've spoken about monetary rewards. Time for me is very important because you need to raise your family, not just throwing money at them. You need to be there for them. All right.
And you're quite right, because when you over 40, that's the thing that you want the most.
Yeah.
Time
yeah,
with your family, right?
Yeah. So the other thing that I've also realized is that, I mean, in our practice, we also get to do research, right?
Yes.
So
yeah.
people should be on the lookout of the things that are coming up. So if you are that person who likes to be in the academic sector, public, if you meet with the right kind of people, you can have that exposure as well. There are things, you guys travel a lot, right?
Yeah, we do.
International.
Yeah, so that's the big part of what I enjoy about our field as well, is that we're very high tech, so, right? So in our field, we do a lot of sort of cutting edge technology work. So yeah, very pacemakers we do a lot of the mapping of the heart, electrical systems, and these are all things that are sort of developing as we through the years.
Yeah.
So it's advancing
And
all
Pushing
the
the
time.
envelope,
yeah.
you're right
yeah.
on the edge.
So-
And we're very blessed in South Africa because you get these technologies very early on.
Yes.
You know, we're not lagging by 2-3 years from the international.
Not at all,
So you
yeah.
guys, you're right there,
Yeah.
learning with the best.
Yeah.
And you the best yourself. I mean, I keep saying this. Of all the technologists in SA, these are the two best, and there's no doubt in my mind. You know, you can
you.
moan and beach wherever you are.
Oh,
No,
my word,
seriously, you know,
yeah.
and like I said, we fight in the lab, but these guys are the best. You know, and having worked with them for over a decade, it's what 25-year experience combined, the two of us, the three of us. So that's great. So you travel. There is some rewards, monetary rewards, time, and research.
Research, yeah, it's important as
Yeah.
well, yeah.
So if you were to, oh no, before you get there, you spoke about going overseas. Okay, I'm gonna turn my attention to you now because you came private practice, and you decided to do some additional stuff in terms of making yourself better. What is it that you did, and why did you decide to take those exams?
Well, for me, initially, like I said, I was in pediatrics for a good 5 years. And I had nothing on my name to say that I have this qualification or the skill.
No, you had a degree.
Well, a BTech
BTech.
degree, which a guy who just finishes now has a BTech degree, right? So I felt
Okay,
like...
wait. You have a degree. That is huge.
It is
already
huge.
Keep it puts in a small bracket.
Yes,
and we've
but
done
I want
very well.
I want to
Yeah.
also know that I've got skills, and sometimes people only see you from what they see on a piece of paper.
Okay, yeah,
And-
that is
and-
also true.
Yeah, and they'll see, okay, Justin Ragadu, technologist, and then somebody who qualified yesterday is technologist.
Yeah.
Which I feel like I wanted to elevate myself, so I have the skill, but yet I had nothing to say for it.
Yeah.
So now I got into EP, and then I was like, okay,
What is EP?
electrophysiology.
Okay, electrophysiology.
So I got into electrophysiology, and I'm like, okay, what can I do to sort of get that credential to say I'm an electrophysiology qualified tech,
Tech, yeah.
which is a speciality, right? And so the only thing that I saw was available to us was doing an international board exam for rhythm examiners, right? So I said, no, I'm going to make sure that I try my best to get this qualification because it sort of sets me apart, and I have this on my name, and it's something that is
What
something
examination
just
is what is it called?
It's the IBHRE exam. It's International Board of Heart Rhythm Examiners, right?
Yeah.
So you can get it for both as an EP specialist, and you can get it as a cardiac device specialist, allied.
What kind of devices are you talking
Cardiac devices, so loop recorders,
Pacemakers,
pacemakers,
ICDs,
ICD,
yeah.
CRTs. So they basically examine you. It's an internationally recognized certification, and I want.
And
to
you write
try
the
to
same exam as a guy sitting in India,
That's it.
Argentina,
It's international.
Nigeria.
Yes.
You can walk into New Zealand now with the same qualification,
And it's
the same
recognized.
recognition.
Yeah. So I felt like, okay, this is
We're not
something-
encouraging people to leave, but I think for me as an older person and sitting with relatively young men here, and hopefully some young ladies out there, is that when you become a technologist, with or without this exam, you can work everywhere in the world. But if you've got this IPHRE exam, I mean, the world is your oyster, as they say. So it's quite important for people to understand that there's so many opportunities that you can do. We did talk about the issue of bottleneck when people cannot get jobs. And once again, I'm a big fan of people traveling outside South Africa, outside the continent, or people coming from North America, coming to South Africa, coming to Africa and see what we do and see what they do. So these exams from BTech to IPHRE provide with that.
The only thing would like see in our context, there is no course that you can say I did this course, and then you EP certified. So we learned mostly on the job with you.
You actually are our teacher. Yeah.
And then also industry helps a lot. And being exposed to these international
Conferences.
Also
Yeah.
we trained in different hospitals, UK and
Yeah, we actually went to
Europe.
Oxford to train.
yeah. So
as
these
well,
are sort
yeah.
of things that equip us to be better technologists
Yeah.
in electrophysiology. So
And,
those are
and
invaluable.
all those opportunities were just given to us because we stepped into electrophysiology with Dr. Brian Vezi. Yeah.
I know I say this and I believe this, but I just want to walk back on my statement. You know, in your field, people like Vishal Maharaj were there in the forefront and they introduced a lot of people, at least in the region.
Yeah,
so we're
sure.
happy that there were people like him
Yeah.
who, for whatever reason, they made this, they heightened awareness. So those people. In terms of EP, I like to reach out to the guy that's in Cape Town. For me, it was a doyen of. I know. I looked at him when he came to Albert Tulu with AO. What is his name? Ryan.
Ryan, yes. Yeah,
Ryan.
Yeah.
What's his last name?
Not sure, yeah.
Keep on Ryan.
Yeah.
Ryan. Which hospital is it at in Cape Town? Mediclinic,
I think it's, no, Panorama.
Panorama.
Yeah.
No, yeah, okay. But Ryan was was the first electrophysiology tech, and when I looked at him doing things that he was doing, I was like, how do you even know?
Yeah.
So I was in awe when I saw him, and you guys are doing like with your eyes closed now. So it's good to know there were people like Ryan, people like Vishal who heightened the awareness.
Yeah.
And for me today was really to let people out there what you do, the importance of clinical technologies, and also reaches out to young people who are doing, we call it 9 standard, 10, grade 11, 12.
Yeah.
If you're tinkering about something, you are unsure, I think it's a great profession
I do
Yeah,
think so too.
I think so too.
to be at. Is there something that you'd like to share with anyone, out there about what you do?
Oh, it's very interesting. Electrophysiology is an extended branch of cardiology, right? They don't offer it at DUT or even at Albert Luthuli. They're very minimal. They do it. They don't hardly ever do electrophysiology there, as far as I know. But
But as
we
a clean tech,
were-
just for me, just as a clean tech, because that's a foundation, right? There's something out there that you could be a breadwinner
yes,
for your family.
100%, yeah.
You could travel because people are thinking, why do we travel? We travel a lot in our group because we involved in Africa Heart Rhythm Association, where we go to different countries in Africa, particularly doing procedures with our colleagues out there, and these guys also teach their local technologists, so which is very important for us, for indigenous people, because generally, if you're in Kenya, because of colonial rules in the past, Kenyans will go to either India or UK. People in Mauritius will go to France or UK. People from Nigeria will go to UK, and Francophone countries will go to France. So we provide that kind of services, hence we travel a lot. We also like the sponsors. People like, for instance, Biotronic, maybe Boston Scientific, Abbott. Who else is out there? Sorin. There are so many of the
Medtronic,
guys. Medtronic. These are the people that we work with to make these things happen. But we're very grateful to the government and hospital. We know things are falling apart, but the fact that we can still have these skills is extremely important to me and to my patients, because without clinical technologists, I can't do anything. All right. So, Justin, any words you'd like to
No, well,
share
Yeah.
with particularly with the young people out there?
Well, from my side, I can tell you my job gives me a lot of satisfaction. I think if you are thinking about getting into a field, always try and enjoy what you do. Not
It's going to be doing for like 30, 40 years.
yeah, like me, I'm just blessed. I started 21 and I feel like I'm just going to be 40 now. And I've got so much of experience and I'm still hopefully
And you could
young.
walk into any university out there in the world and be what you are here in SA, right?
So
Because
it's a lot of value, and I think you can grow as a person. We're in a field that is so much evolving. It's so much of dynamic things that are helping patients. Year on year, things are just getting better and better, and we're at this sort of forefront here. We're blessed to be working with a doctor who is also very dynamic. You're also at the forefront of doing things that we just went to a conference, and it was so made me feel so good to see that we are up there, with first world. We were even presented on there. So those are things that fulfill me as a person, to know that yes, I get my time, I get paid well, I get to travel, but my job is so important as well. I'm helping patients, and there's just this all-round view where it brings that satisfaction to your life.
yeah,
And
I
that's
think job
important as you
satisfaction
get
is
older.
very important,
Yeah,
because
yeah.
you've got people every Sunday evening, they're like, oh God,
Yeah.
I have to go to
My
work,
day.
and I can't wait for Friday.
Yeah.
So that is extremely important. The other thing that you didn't touch on, I know you guys are far from it, the independence that you have, that come age 64, 65, you're not worried about getting fired or forced retirement, because let's look at it. We're not the first world, but you're getting there in terms of small pockets in South Africa where if you earn well, you're expected to live to at least 75, 80. Someone dies under 75, you're not that old,
Yeah.
But if you work in a government setting or where you cannot be independent, come 60, 64, you haven't paid that mortgage bond, you're like, how am I going to live for the next 20 years? Yeah, because you retired 65, you died 85, that's like 20 years. I mean, retirement has become so expensive. So someone like me, I'm not really worried about that, as long as I still have the ability to do what I do. So my mind, my hands, and you guys in the same boat as me, where you can work until the day you die, or you decide that I'm done.
Yeah.
So that's also very important, because of our circumstances, you could find yourself having kids maybe that are dependent on you financially until you're 60 or 65. You haven't paid your bond now, or you haven't invested well. So what I like about us being in private practice is the fact that among all these beautiful things you've said, we're not forced to retire.
Yeah.
All right.
Yeah.
All right. You can slow down. You can work 2 days a week. You can work 3 days a week, and even work 1 day a week. You're still getting satisfaction of your job. You're still getting some sort of financial reward.
Sure.
So it's very, very important.
Yeah. It's your choice, right? You get to do what you want to do. That's important. Yeah.
So to the kids out there, clinical technology is one of the big opening. And I said this because I have a nephew of mine who's like a son to me in Jabulo. I know these two guys will really trying to help him to get into clinical technologies. But for whatever reason, maybe it was a bit too late for him, because he's a hardworking man. And I said to him, Jabulo, had I known about this, we would have been better off served there, because we know certain careers. Obviously, I'm not an expert in this thing. My brother is an engineer, and Jabulo is an engineer. And it's hard for them to get a job.
Yeah,
it's
sure.
hard for them to be independent. And I'm sure there are many other professions where they find themselves in a sticky situation. You spend time, you spend money, and you find that you've reached the cul-de-sac at the age of 25.
Yeah.
So I'm glad that I know people like you, and hopefully with this podcast can reach to as many youngsters out there, that there are other avenues that are not taught at school by your guidance teacher, that this is what you can do.
Yeah.
Gentlemen, thank you very much.
I appreciate it.
Thank you.
Yeah, thanks for having us.
Sure. Thank you.
And thank you to Mawanda.
Don't cut that part out.
Yeah.